On day one, there were 2 people, and then 4, and then 16. In 3 months, it's 1 billion. That's where we're headed.
The new movie Contagion opens in theaters today. It's about a deadly virus that rapidly spreads around the world. Experts say it may be scarier than any horror movie this season because it could actually happen. Right, Alex?
You're right about that, Mary Beth. The filmmakers say the concept is based in real science and real possibilities. Infectious disease specialist Dr. Manoj Jain is here to explain. He also writes for the Washington Post. Jain, always glad to have you back here.
Oh, I'm happy to be here, Alex.
Now, you and I were talking a little bit earlier behind the scenes. A lot of folks are going to probably rush out as early as today to go see this movie, but after they see it, they're going to be wondering, can this really happen here?
Sure.
What do you say?
Yeah. First of all, we got to remember that it's Hollywood, but there is a statement that the Centers for Disease Control put out yesterday, and what they said was that not only could this happen, but scientists at CDC are working 24/7 to make sure that if it ever happens, that we can control it, we can manage it. So the plot is very plausible, but obviously there are many ways that we're trying to contain these viruses and germs, which seem to be coming out, about 1 every year.
And what's also interesting, Doctor, you've worked behind the scenes before, to help prevent outbreaks around the country and world. What's that process like to really try to make sure we are as safe as possible?
Sure, absolutely. I'll tell you a case. A number of years ago, I was involved in a hospital setting where we began to see an increased number of deaths among patients who were coming from a nursing home. And we couldn't figure out what was going on. And that's when we began to investigate. And we called in the State Health Department, called in the CDC, and there was an investigation. There probably was some virus. We couldn't identify it. But what's really incredible is that there's a process. And there are investigative units, similar to the CIA is an investigative unit, called EIS. And the CDC has those investigative units that come into a situation, look at what's going on and if there is an epidemic or not.
I know you mentioned a key word a little bit earlier. We are talking about Hollywood here in this case, but the average person may be wondering, is there anything that we can do, along with the CDC and others, to help prepare for a potential disaster or outbreak?
Sure. Be informed. So that's one of the things that's so critically important about these infections that are happening. Also, if people begin to see an excessive number, especially healthcare providers, in their hospitals or in their clinic, an excessive number of illnesses such as diarrheal illnesses. In fact, in Germany, if you know about the E. coli epidemic that occurred, it was 4 cases that came in with similar types of diarrhea, and all of a sudden an investigation was started. So people can alert their providers if they begin to see a common illness in a community.
Dr. Jain, are we also seeing more germs out there? Are we also seeing other kind of potential viruses, H1N1, just to name a few? What are we seeing out there?
So if you look at the past decade, we have had the avian flu, the bird flu, and then we had SARS in 2003, and that was really scary because the SARS epidemic really got cities such as Hong Kong and Toronto to sort of close up, and then H1N1 last year, and luckily that wasn't as bad as we expected in terms of the deaths and the illnesses it caused. What the CDC sort of looks at is that there will be new and different germs that are coming out every year. They need to be on top of it, and they need to make sure that these illnesses are contained.
And doctor, of course, not to scare anyone out there, but do you see some positive things from a movie like this to come out? Obviously, we're having this conversation this morning.
Sure. I think it's a learning lesson for all of us. We have ways to prevent illnesses, such as influenza. These viruses are very similar to the influenza virus. There are vaccines that are available that can help people, and obviously hand washing. We know that that can prevent illnesses from spreading. These illnesses spread from person to person. Just to give you a quick overview on this idea, terrorist attacks and natural disasters pull people together. But an infectious disease illness, a contagion, tends to pull us apart because we spread it amongst each other. And so we need to be very cautious about these illnesses.
All right, very quickly, will you see the movie yourself?
Tonight I'm going to see it.
We know where we can find you, Dr. Jain. How can we also get in contact with you?
I have a website, www.mjainmd.com.
All right, as always, good to see you, sir.
Thank you.
Right. Mary Beth, back to you.
Alex, ask Dr. Jain if he can do movie reviews for us next, okay? That could be a regular there.